Hello everybody, I'm Dr. Harpreet Walia. I'm a consultant in head pathology at Sohana Hospital, Mohali, and today I'm going to talk about cancer, which is a subject very close to my heart because day in and day out I'm diagnosing so many cases of cancer. Not just diagnosing, I'm also witnessing so many people who are getting better and even getting completely treated. So how is that possible and how does lab help? So lab helps in the prevention of cancer, diagnosis of cancer and even treatment of cancer. So prevention of cancer, even the simple blood tests like the CBC, blood glucose, the tumor markers, a urine examination, a stool or gallbladder and a pap test. These can catch cancers at a very early stage, and we can even prevent them from coming up or even spreading. And then coming to the diagnosis of cancer, there is something called a final aspiration cytology and biopsy. So final aspiration cytology, we can do it whenever there is a lump felt in the body. So what we do is we just take a small sample through a needle, a simple syringe and a needle attached to it. We take a small sample, we take the tissue, we spread it on the slide and then we view it under the microscope, and then we tell what is the nature of that swelling, whether the swelling is because of infection or inflammation, or whether the swelling is because of some tumor that may be benign or malignant. Now a benign tumor is something that will not spread far away, but it can just grow there and it may cause some local symptoms, and then a malignant tumor is something that has the potential to spread. So the malignant tumor is something that we need to watch at an early stage, because if it is caught at an early stage, we can totally cure a patient if a malignant tumor is caught at an early stage. Because if we catch it somewhere before the spread, we can have very good results with treatment. Now coming to the treatment part, because there are so many kinds of tumors in the body, we can tell what kind of a tumor it is. We can go for molecular profiling or molecular pathology of the tumor, from which we can know the culprit gene that is causing that tumor. Now gene necessarily is not always hereditary. It can be somatic also. Somatic means something that we have not inherited, but we have just caught on in our lifetime, because maybe because of our poor lifestyle habits, or maybe because of the air pollution, the water pollution, there's so much of plastics pollutions, and maybe because of our own, if we are not controlling our sugars, if we are not controlling our blood pressure, then the somatic mutations can happen. So the gene molecular profiling of a cancer can be done, and through which we can know the culprit gene. Now once we know the culprit gene, a targeted therapy for that gene only can be given, and through which we can help treatment. And with treatment, I also mean that we can help to know whether the treatment is going to help the patient, how much it is going to help the patient. And during treatment also we can also find out whether the treatment, how much is the the response to that treatment, and whether some other treatment can also be added, or maybe the treatment might be completely changed once the genetic profiling is done. So I hope this is just a small bit that I've tried to sum it up for you, how we as a lab can help you fight against cancer in its prevention, in its diagnosis, in its treatment, in monitoring the effectiveness of the treatment. And at Sohana Hospital we have all the facilities available. Please come and visit us. We've got the best of specialists here, the best of cancer specialists are here in our place. And as a pathologist, I'm always happy to talk to you about the diagnosis part. If at any time you need to have some, you need to talk to us regarding the reports, the lab reports, we're always happy to help. Thank you so much.